In our last video, we discussed about obsessive and compulsive disorder. I already said some of the relative disorder are there for the OCD. What are the relative disorder? Myself Sukumiii, I am the student of occupational therapy. There are 8 related disorders for OCD. First, body dysmorphic disorder. What is dysmorphia? Dysmorphia is the imagination of our body has something fault. So it is good, so it is not appeared for the other persons are say you are very good, but the person feels I have some lack, that like false imagination about body is there for this patient. So these persons perform repeated actions like mirror checking, grooming and reassuring with others. So am I good, am I look like good, that's like they are reassuring, picking skin and check. So that's like activities are they repetitively done. For body dysmorphic disorder, these symptoms cannot be explained by the eating disorder. If they are thin or fat like this, they also check for the mirror. So it is not explained by the eating disorder. These people may have anxiety and social anxiety and avoidance from society and having depression. Some person having perfectionism. They want to be perfect in everything. So they have obsessive thoughts with how they are looking. So they care about their look and think about that look. They may go for the cosmetic treatments. Some person do surgery for themselves. So they take the stick or knife and take the and place the surgery like this. Don't think negative. That's just grooming. Okay. And they perceive everyone's response is a negative response for me. That like they are perceiving. But they are giving a positive response only. But they imagine it is a negative response like that. Then hoarding disorder, in this the person doing saving their possessions. So they are having fear of taking their possession from others, so they protecting their possessions or they hide from the society. Symptoms starts to show in 11 to 15 years, but more prevalence is 51 to 55 years. They are diagnosing in this age, but their first symptoms are shown in 11 to 15 years. Mustache, beard, eyelashes. So if women, they are always eyelashes and eyebrows are they pulling. These person may have other focused body focused symptoms. So like they repetitively biting the nails. So or any other body parts pulling activities. They also want to stop this behavior, but they try these to stop these activities, then they may have distress and they can't stop these activities. This trichotillomania may start after the puberty. Some persons pull their hair and start eating. So it is very dangerous. So it is harmful to our body. Some persons may cause irreversible damages to themselves. Then excoriation disorder. It is skin picking disorder. In this, the person doing skin picking repetitively and it result in the skin lesions. They also try to stop the skin picking behavior and they again distressed and again start the same behavior recurrently. For these persons, pain is not reported. The lesions may cause scarring. Usually this skin picking behavior done in alonely. So if they are alone, then they may do the skin picking. Then substance or medication induced OCD. In this we are seeing like skin picking or a hair pulling or any other repetitive behavior is formed due to any substance intoxication, which means substance is overly used or substance withdrawal. So when the person try to withdraw the substance, they may have these symptoms or in exposure. So substance exposure, after taking the substance, they may have these symptoms. So these are all the induced by any substance or any medication. So most common drugs like cocaine, this like. So it is a very rare disease only. Then OCD due to any other medical condition leads to repetitive behaviors. So it is are other specified. What are all we said? So these are all the specified OCDs. If the person having very different OCD, then it is other specified OCD and unspecified OCD. So in washing, so they are repetitively washing their hands. In hair pulling, they are repetitively hair pulling. So these are the specified OCDs. If the person having any some things are doing, so some things they are not doing like that. So it is an unspecified OCD are also there. Okay, yes, today we have seen about what are all the relative disorders of the obsessive and compulsive disorder. In our next videos, we are going to discuss about various topics. Thanks for watching. Be proud to watch this video. Tata.